Hi, it's Adrian from the Advanced Denture Centre. There are many problems having full upper and lower dentures, and what we generally see, of course, is that the mouth is always changing. Our body is always changing. We're finding that our bone is remodeling, and of course the gums in our mouth and the bone in our mouth shrink over time. Once we remove teeth, one of the issues that we see is that we will see a huge amount of shrinkage over the first, say, 6 to 12 months, but there will still be a gradual shrinkage of the bone and therefore the gum over time. So one of the problems we see, of course, is dentures go from being very well-fitting to actually getting looser and looser over time. We see this more in the lower jaw than we do in the upper. When it comes to the upper, because of the palate, we get a lot more suction, a lot more support. But when we look at the denture, because of the position of the tongue, there's no way for us to actually get any suction. So therefore we see a lot more problems with the lower dentures. Over time, of course, these changes in the mouth, the shrinkage not only of the gum and the bone, but also the wear of the dentures will cause a change in the patient's face and definitely their lip support. The other issues that we of course see is we see that if patients have poor hygiene with dentures, is that we can see fungal problems with dentures. We know that there's a lot of bacteria in the mouth that is always there, what we call commensal bacteria. There's also commensal fungus that's also in our mouth too. And if oral hygiene isn't good around dentures, we're always going to get problems with fungal problems. And this can be twofold. It can sometimes just be a bit of what we call angular colitis, which is actually like a cut on the side of the lip. And that's due to not only a fungal problem, but also a loss of the height of the face. And therefore we get a wrinkle or a mark or a sore always in the corner. The other issue we see, of course, is that as the mouth changes, we also find that the dentures don't fit so well. So we're going to get retention problems. And if we get retention problems and the denture moves too much, we also find that we're going to get ulcers and sore spots. All of these things can actually be resolved by a new set of dentures or possibly even a reline of a current set of dentures. The most important thing to remember though is that dentures are a prosthetic device. They're there to replace something which is missing, and like an artificial leg or an artificial arm, there are limitations to how well we can get these to fit. But if you're looking at a new set of dentures or you'd like to get a second opinion about dentures, please give the Advanced Denture Centre a ring.